Hi everyone, my name is Daniel Isian, a student of University of Health and Allied Science from the Department of Basic and Biomedical Science. I welcome you all to my YouTube channel where we discuss the various health issues affecting the well-being of people. And today, we are going to tackle one most important thing. Breathing is something we often take for granted until it becomes a struggle. Picture a little boy playing on a field, running towards a ball and stopping in the midway, clutching his chest and gasping for air. Or an adult suddenly awake in the middle of the night, struggling to take a single deep breath. To many people out there, this struggle has a name and it is called asthma. So in this video, we are going to tackle what asthma is. We are going to talk about the causes and not forgetting about pathophysiology. We are going to talk about the symptoms. We are going to talk about preventive measures about asthma. So stay tuned and enjoy. So, according to World Health Organization, asthma is a chronic inflammatory of the airways whereby a normal airflow is being disrupted. And this condition can be acute, that means it occurs suddenly with severe attack, or chronic, meaning it persists for a long period of time with recurring symptoms. So, on the causes of asthma can result from both genetic and environmental factors. And on the genetic factors, individuals may acquire or inherit specific genes from parents which interfere in the normal function of the immune system, causing allergies, especially to dust or pollen. And on environmental factors, something like smoke, cold air, and a strong scent perfumes can also cause asthma. And also, respiratory infection can also cause asthma. So let's look at how the body functions or how breathing occurs in the normal lungs. So air enters our body through our nose or our mouth, and it moves down through the trachea and fills the bronchi and the bronchioles, where it's moved down to alveoli. At this place, gaseous exchange occurs. That's oxygen is exchanged with carbon dioxide, and through this mechanism, airway stay open, smooth muscles stay relaxed, and air is allowed to move freely. Now, let's look at the pathophysiology of asthma. When allergen is inhaled, it triggers the release of antigen-presenting cells, in this case, dendritic cell. Dendritic cell present this allergen to T2 helper cells, and upon receiving the allergen, T helper 2 cells release its cytokines. They are interleukin 4, interleukin 5, and interleukin 13. Interleukin 4 and 13 stimulate the plasma cell to release hemoglobin E or IgE. IgE, upon being released, also release mast cell. And mast cell, through the process of degranulation, releases its granules. They are histamine, prostaglandin, and leukotriene. These chemicals constrict the airways, making it difficult for air to pass through. And also, interleukin 5 also stimulates the release of eosinophil. Eosinophil, upon being released, also releases cytokines and leukotriene. This also damages the airway lining, making it difficult for air to pass, causing asthma. Now, let's talk about the symptoms of asthma. The most common symptoms of asthma include wheezing, shortness of breath, coughing, and chest tightness, often worse at night or early in the morning. Let's look at how we can manage asthma. Asthma has no permanent cure, but it can be properly managed. 1. By avoiding the triggers, and also regular medical checkup and monitoring. And don't forget to pay attention to your doctor's advice, especially when it comes to using inhalers like the corticosteroid. So in conclusion, asthma may challenge the breath that we take every day, but with proper care and management, it can be controlled. Don't forget to stick to your treatment plan. Also, avoid triggers always. And anywhere you go, don't forget your inhaler. Stay safe, stay strong. See you in the next video. Thank you for watching. Don't forget to like, subscribe, and share. Bye bye.